Bartley, Principles of Platinum Leadership.
And I'm Michelle Hurtubise, Executive Director of London InterCommunity Health Centre.
Over 6,000 people who don't have a doctor rely on the health centre, which helps people lead healthy lives in addition to treating the symptoms of sickness. The centre's staff provides primary care, community supports, and social services for many who experience barriers between themselves and the resources they need.
In October 2014, we invited Andrew and Corinne back to the health centre to work with our joint leadership team. This team coordinates the work of over 100 employees and over 200 volunteers. In order to strengthen the supervision and support our people offer, Platinum Leadership facilitated Situational Leadership II pre-work, on-site training, and follow-up coaching for our team.
Situational Leadership II is a model for helping others develop their leadership skills. It requires leaders to adopt an attitude of service, inviting and equipping those they lead to request the support and direction they need to be most effective. The model helps leaders diagnose the task-specific development level of their employee or volunteer and to align their leadership style to optimally support and direct that person as they achieve their goals.
In our experience, Situational Leadership II leads to an increase in the quality and quantity of conversations a practitioner has with the people he or she leads. Practitioners learn to diagnose the developmental levels of their employees on a particular task, provide a leadership style that's a good match, and partner for performance going forward. It can make a massive difference in an organization's culture, helping leaders implement strategy to achieve their vision.
Our leaders have become more flexible and skilled at goal setting, coaching, performance evaluation, active listening, giving feedback, and proactive problem solving. This has resulted in an increased accountability for both individuals and the entire health centre by linking goals and intentions to action plans that deliver results.
On the final day of training, here's what participants had to say.
I think it really improved communications between myself and the team or the individual I'm working with, and as importantly, improve outcomes. I think the training has given me great opportunity to be introspective and learn from your previous experience or your existing issues that you're working through right now. And so that opportunity to reflect on real situations really helps to solidify the learning.
My experience with supervision, there's often a lot more than one goal or task involved in the meeting. There's multiple goals or tasks, and even within a goal there's multiple tasks. So thinking about it in a more dynamic way in terms of matching the right supervision with what the person needs.
How do I create spaciousness in my schedule to check in so that there is actually an opening for people to be able to say, I have this need, because we're training them how to ask for what it is they need, but I see it as my responsibility to also create the space to allow that to happen.
It can serve as a guideline for having healthier conversations with people that we are supervising. It enabled conversations between peers in supervision and even between managers and team leads that we hadn't had before. I think that maybe those conversations happen in a sporadic or incidental way, but they were really intentional today.
The language has become part of our organization. It's how we're giving direction. And I've certainly noticed even within the management team, they're coming to me using the language saying, I really think that this is a D2 task for me or a D3 for me, and actually asking for the support at that level. It means for me as a supervisor, I'm able to more also effectively target my response to based on what their stated needs are. What was uncovered for me really in the one-on-one coaching sessions that we had that followed up was really allowing me to identify and place myself in the scale within the team around a couple of big projects that we have going on. I'm at D1 around some of this capital project piece. Being able to articulate it in that way helps normalize the experience across the whole leadership team. It's really important because we work with really vulnerable, complex individuals. Our staff are expected to take on a wide range of different kinds of tasks and responsibility. Every day they're learning something new. In terms of the value, there is tight restrictions on resources for nonprofits and really for any organization. For me, the investment in terms of developing effective leadership strategies is money well paid, well spent. It allows us to really capitalize on more effective supervision, which actually is a time saver in the long run. Our tagline is everyone matters. And for me, how this fits to situational leadership is that it really provides an individual response to what the supports are that somebody needs. It allows us to say that you matter, in terms of your development that's in front of you related to this task, and we recognize that that is actually situational. And it's also the essence for me of what leadership is. Everyone matters, every task matters, every situation matters.